Dr. Meenakshi's presentation is next. I invite Dr. Meenakshi SWAMINATHAN. She is the former Director of Academics at Shankar Netralaya, a world-renowned pediatric ophthalmologist, and most importantly, an educator at heart. And she is going to talk to us about what to look for in a fellowship program as one enters. Partho, please come up. Dr. Devesh.
Good afternoon. Right, this was the title given, Entering Fellowship, What Do Course Directors Look For? I thought I'll talk also about, before entering fellowship, you've got to go through fellowship interview, right? So let's talk a little bit about what that involves. So, no financial disclosure. So I was looking at it as 3 stages: preparation, presentation, and performance. So this was 2020 pandemic. Most of us were sitting at home. Hospitals were closed. So I took up cooking. And I got really carried away. Then slowly I would call small groups of friends to come and eat and sample my food and all that. And I started photographing like crazy and putting on Instagram. No recipes and all, just photograph. Okay. So those are some of my creations. Okay. And this is not a quiz. I'm not going to ask you what are these dishes. But that got me thinking, it's the same for food as for interview. How is it the same? So imagine food. I'm going to throw a party. And what preparation I have to do? For cooking, I have to get fresh ingredients. Okay, all have to look nice and fresh and all that, healthy. I have to look up the recipes. I also have to note down what is the date I have invited people, what are the time I have asked everybody to come. The same way, before the interview, make sure you note, especially you have 3 or 4 interviews lined up, make sure you note the date, time, venue of interview, read up on the faculty of the department and their interests, what is the latest research going on in your field of interest, revise the basics, nobody will forgive you if you don't know the basics, and of course look at the common conditions and open an atlas and look at some of the photographs, especially if it has been some gap between your passing the DNB or MS and then going for interview. And please update your CV. So we come back to the dinner. Morning of the dinner, what do? We have a checklist, right? Did I, wipe and get the glasses ready, the plates ready? Do I have enough bowls, enough cups, etc.? Do you clean the house? It's all important. Appearance is so important. And then you also have a head count of people who are coming, and then, what is your food preferences, etc. Similarly, before the interview, arrive the evening before. I know a lot of people will come running that morning, take an early flight, disheveled, try to get there by overnight train, train will be late. No. Avoid excessive food or alcohol, get a good night's sleep, calculate time to get to the venue, arrange all papers and documents so you're not fumbling through them when I ask for something. Book a cab, okay? Set out your clothes the night before. And you may think, what is this? All common sense. Why is ma'am saying this? And I have, if I have time, I have an example for each one of these, okay? Keep a double alarm or ask the hotel to wake you up, okay? So now the dinner has come. The dinner actually is happening, and the presentation. Look at that. That's a lowly rasam. Well, not lowly rasam, but it's in a short glass. And this is a very uniform, white-looking sabzi, but I've put it in a red bowl for contrast. And look at this. I want to show it's made with banana flour. So I don't do any of this anymore. Huh? This was all COVID. I had lots of time to do all this. And so you see the banana flour there and so on. So, appropriate attire. Okay, well-groomed. Should you shave? Should you trim your beard? There are some institutes where a beard is not tolerated, I hear, nor is a mustache. So, be vigilant. Do your homework. Don't wear a white coat. You're not going to see patients in the interview. I'm not going to ask you to see patients, right? Should you wear a suit? It's a very mixed thing. Some people like to wear a suit. They think they had some more professional appearance. For me, when it's 36 outside and you come in a suit, I'm thinking, what? Okay? So, also beware of body odor, chipped toenails, half-removed nail polish. Believe me, I notice everything. At least I used to. Because if you're a pediatric ophthalmologist, most of your information comes from observation. You cannot go near the patient. So you really, and I'm a bird watcher in addition. So observation, observation, observation. That is what, so you notice everything, okay? Arrive early. Don't do excessive, somebody will try to be very friendly with the administrative staff and go ask them, did you have breakfast? Don't do all that. It's very annoying. And don't skip breakfast. Stay hydrated. I'm feeling so faint. Not going to get you any brownie points. But ultimately, it's the performance, right? So it's like we say, the proof of the pudding is in the eating. So it's the performance in the interview. Correct, appropriate greeting, body language, content. Finally, you have to answer the correct questions, correctly. And taking leave. Goodbye. Should I wait for the results? Will somebody tell me outside? And this is the right way to take leave as well. Okay. So I'm going to give you a few illustrative examples to say how each one, behaved during an interview. This was Dr. Dream Job. Because our institution used to have a peripheral branch in Rameshwaram, really the southern tip of India, okay? And if you go there for 6 months, you will be given a lot of preference or sometimes just handed the fellowship to you. So this person had finished 6 months and sauntered into my room. And I was interviewing for pediatric ophthalmology, and he said he wanted pediatric ophthalmology. So I open his CV and I find I am passionately interested in vitreoretina. I said, sir, doctor, are you in the wrong interview? No, ma'am, I forgot to change CV. I just thought it would. That doesn't look good, right? And then this is another, doctor who did not answer a thing, but quickly noted who was interviewing next to me and was very coy during the whole of the interview, doing this, and I don't have much hair and it's all gray, but you know what I mean, all that. No, don't do all that. That's all very annoying. We don't, in fact, I don't make eye contact. I'll be looking at somewhere listening to the answers, right? So that's what is important. This one was really a red flag, okay? So this was a male doctor interviewing for oculoplasty. The HOD was interviewing. And I had just stepped out and I walked in. And then this candidate never made an eye contact. Did not even notice somebody, and I used to be at least 10 kilos or more, Didn't even notice and looked in my direction. We sat there, I asked questions, but he would answer to the other doctor. And then while leaving, and then after some time, he went back in the sofa, one leg over the other. I'm wondering, who's interviewing who? And then after some time, while taking leave, again said goodbye and thank you to the male doctor. I'm thinking, after the HOD, all the other assistants are ladies. How is this man going to listen to any of them? So obviously, we didn't pick him. Okay. Anyway, now congratulations, you're entering the fellowship. So remember, hospital duties, roles, the medical superintendent, director, academics will tell you, and you will learn all about it from the seniors, or there may be a manual, or the orientation that will happen, or the secretaries will tell you. Fellowship duties and roles, the fellowship course director is the one you report to. The seniors, again, the department manual, and a curriculum. Hopefully, a good fellowship will have a curriculum with resources that they will hand to you during orientation. And the next 2 slides may look boring, but they really are the meat of the stock. So, what is expected of you as a fellow? Well, clinical training and patient care. Hopefully, you will engage in good, direct patient care. You will be doing surgical assistance and participation, running subspecialty clinics, and emergency and ward rounds, and research and academics. You will take up research projects, teaching and mentoring the postgraduates or the medical students. You will attend academic meetings and conferences and journal clubs and do presentations, publications. You will maintain a logbook and be involved in administrative tasks as well. And like, say, maybe you have to give a case summary for patients, right, of your consultant, and be involved in continuing education. And let me go to the last but one slide. But paramount important, patient safety and quality improvement. You will be conscious of that. And you'll coordinate it for patient-centered care with other departments, other hospitals. Patient needs to be sent for an MRI. And if the patient is just lounging around and fumbling around and the fellow is responsible and nothing has moved, you do note that as a fellowship director. And you learn to work with limited resources. You're not going to be may not be in a big institution when you leave. You need to know how to work with limited resources and not start writing all kinds of diagnostics. Evidence-based practice, reflective practice, and commitment to personal growth. What did you learn in the last 1 week? You should be able to think about it and talk about it, reflect about it. The last 2, very important. And as a fellow, do you demonstrate professionalism and ethical behavior, accountability and consciousness, self-awareness and help-seeking? When you don't know, do you know to ask? I don't know. I think I may have missed this. It's okay. You're in training. You are allowed. You should ask all these questions. Okay? Somebody is there to help you out. Someone is there to take care of you. And interpersonal communication skills. Are you good at patient and family-centered communication? Interpersonal and interprofessional and team communication. And finally, are you good at medical record keeping? Both handwritten records and EMR. And are you irresponsibly sharing, I did this TOSI surgery yesterday, look how good is the outcome on WhatsApp groups. Okay, all this is important, okay? So that is why, years ago, during the first day of orientation, I went home and found the resident had actually sent me a Facebook friend request. I was shocked, okay? I was like, how dare you, But then I thought about it. You know what? It's one way I'll keep an eye on you as well. Huh? Just as you will find out about me and the birds I watch, I'm also going to see which birds you're watching. Yeah, it's good. So in conclusion, as a fellow, you're the torchbearer of the institution. And this is my own quote. It is through my students and sharing my knowledge, I become immortal. So that is how important fellows are. Thank you so much, Devendra, for this opportunity.
You're most welcome, ma'am. Thank you so much for being with us. Any quick question for Dr. Meenakshi, because she has another commitment in another hall. We can take that now. Okay. Thank you so much, ma'am. Thank you.